from breast reductions to tummy tucks, and the increasingly popular Brazilian butt lift, BBL. More Zimbabwean women are turning to plastic and reconstructive surgery in pursuit of both relief and rejuvenation. And experts say it's not just about looking better, it's about feeling better.
The reason why it's mostly women that come to plastic surgery is because it's the things that we treat in plastic surgery, right? It's the things that we treat in cosmetic surgery. It's the women that are plagued with breasts that are too heavy for them, that get in the way of function. It's women that have their bodies change significantly after childbirth. So there's a lot of things that come after childbirth: significant weight loss, the change in your breasts, the change in your tummy. So those are the things that women come and actually seek help for. There is a rise, and it's still like on the increase. There's a lot more people coming in every month. There's an increase in that, and yes, there's enhancements of getting implants in your breasts. You can get BBL, which is basically having your bum enhanced by injecting fat into it to make it bigger.
However, it's not only physical discomfort driving this boom. The rise of filtered beauty, fitness influencers, and celebrity culture has reshaped ideals of the perfect body, particularly among younger generations opting for the popular BBL.
The BBL is basically when you take fat from your own body. A lot of people come to me and say, can we take fat from somewhere else? Unfortunately, you can't. So we have to take fat from somewhere else in your body. And usually that's like the tummy. If you have a tummy that has more fat than you want, your inner thighs, your arms sometimes. So we take a lot of fat, and that's through liposuction. And liposuction is basically sucking out fat from those problematic areas that have too much fat. And then what we do is we take that fat, we process it, and then we kind of put it in a layer of your bum to make it bigger. And so yes, and then after that, there's a certain way you have to stay off your bum for a certain amount of time in order to help that fat kind of like integrate into that area of the body.
But with growing popularity comes growing risk. Experts warn that not all practitioners advertising cosmetic services are qualified, and the stakes are high.
You have to go to a person who's qualified. You have to know that this is a person that actually can do the procedure, and they are someone who has been trained in doing that procedure. And this is something very simple to check, especially in Zimbabwe. If you Google a doctor's name, you can actually see a lot of the medical practitioners are on the internet. If you Google your doctor's name, you'll see that the Medical Council of Zimbabwe has everyone on the internet saying who they are and what actual specialty they are. So number one, make sure that you're getting it done by someone who is not just a doctor, but a doctor who's trained in doing something like that, and that you can easily see by what qualifications they have. And also just ask questions. Do your research. As a patient, I know a lot of people are very scared of looking on the internet and seeing the complications that are involved and things that are surrounding a procedure they want to undertake. But I actually encourage a lot of my patients that do your research, and when you go for the consultation, please ask the questions.
As Zimbabwe navigates this new frontier of body modification, the conversation is no longer just about beauty. It's about identity, self-worth, and the evolving intersection between technology, culture, and healthcare. Cosmetic surgery may continue to rise, but professionals agree transformation should never come at the cost of safety, mental health, or self-respect. Farai Gwaze, ZBC News, Harare.